Hi guys, welcome back to my channel. If you don't already know me, my name is Anna. I'm a clinical psychology doctorate student and I make videos about real-world applications to psychology. So please go ahead and hit like and subscribe if you want to see more about how to apply psychology in your own life. So in this video, we're going to be talking about the difference between schizoid and schizotypal personality disorder. And this is something that, most people don't even know about these disorders, but when you do hear about them, it's easy to confuse them. So this is just kind of trying to break down the differences between them and also give some examples from pop culture. So, before we get started, if you don't know a lot about what they are personality disorders from cluster A being the odd or eccentric personality disorders. And this is the cluster of personality disorders most linked to the schizotypy spectrum. So if you don't know, schizophrenia is on a spectrum of schizotypy, and there are also other psychotic disorders on the spectrum that reflect less severe to more severe pathology. So first, let's talk about schizoid personality disorder, and I'm going to be using the DSM-5, which you probably know, or maybe not, but it's where we get all the diagnoses from. It's what psychologists use. So, schizoid personality disorder is defined as a pervasive pattern of detachment from social relationships and a restricted range of expression of emotion in interpersonal settings. So, 4 or more symptoms of the following: doesn't desire or enjoy close relationships, including being part of a family. So, schizoid individuals don't really want to have friends. They don't even really care about family members so much. They're pretty indifferent to other people, and they neither desire nor enjoy close relationships with other people. I think you can see my cat eating there. Another symptom is if they had a choice, they would choose solitary activities almost always. So if you ask a schizoid person to hang out every day of the week, most days they're going to say no. Little, if any, interest in sex with another person. So even if they don't have a sex life or a dating life, they don't feel like they're really missing out on anything. They're not trying to meet anyone. They're not really upset about being alone. It's just kind of how it is. Takes pleasure in few, if any, activities. So they don't have a lot of hobbies. They kind of have anhedonia, which is basically a loss of pleasure in other activities. We see this a lot in depression as well. And they're just kind of hard to get out. They just don't have a whole lot of interest or pleasure in a range of activities. Lacks close friends or confidants other than first-degree relatives. This one's pretty straightforward. They don't have a lot of friends. The only people around them really are their immediate family. Indifferent to praise or criticism. So they're not going to really get offended if you insult them, and they're also not going to be flattered if you praise them. Shows emotional coldness, detachment, or flattened affectivity. So flat affect is what we refer to as kind of like a blank face, no real expression. In general, they don't really express any types of emotions. And if you've ever seen a schizoid person, particularly one that's more severe, you know that it can be really uncomfortable because no matter what you say, their face is just a blank slate. So those are the symptoms, and you need at least 4 to meet the criteria, as well as distress and or impairment, as with most disorders. And some other information about schizoid personality disorder. This isn't in the DSM, but they tend to retreat into fantasy a lot. So these could be sexual fantasies as well as non-sexual fantasies. But for some reason, they don't really have interest in real people, but they fantasize so much in their head about people. So these might be people that get lost in like fantasy worlds, like fictional fantasy worlds and video games, things like that. They're also really unlikely to get treatment because it doesn't really cause distress to them. Usually when they do come in for therapy, it's because their family members or someone close to them wants them to get help because it's affecting them. But that's why, there might be low rates of therapy or treatment for these individuals, because generally they're not going to see any purpose in coming in because they're not upset about their symptoms. Yeah, they don't have friends. Yeah, they don't have activities, but it doesn't bother them. This might be just me. I don't know if anyone else thinks of it this way, but I kind of conceptualize schizoid personality disorder as almost like the negative symptoms of schizophrenia. So if you know about schizophrenia, they have 3 classes of symptoms. The negative symptoms, which are things like flat affect, anhedonia, lack of social interest. There are also the positive symptoms, which are not what they sound. They're positive as in hallucinations or delusions, like actual psychotic symptoms. And there are also the disorganized symptoms, so disorganized speech and thought processes. So for me personally, it just kind of helps for me to think of schizoid personality disorder as the negative class of symptoms from schizophrenia. This doesn't mean that they might not have other symptoms of schizophrenia. There is a large comorbidity between cluster A personality disorders and schizophrenia. It's just more a way of thinking about the disorder. So let me give an example of a schizoid character from a movie. I don't know if you've seen the movie Lars and the Real Girl. It's about Lars, a man who is essentially schizoid. He really has little interest in people romantically or family or close friends. And he gets a life-sized sex doll who he starts to treat as a transitional object for, starting to connect with people. So he initially connects with the doll a lot, and then he transitions into starting to see the value in connecting with real people. And he has a lot of these symptoms. So he doesn't desire or enjoy close relationships. He even avoids his family members. We see when his sister-in-law goes to great lengths to try to hang out with him, and he really tries to avoid those interactions. He also chooses not to go on outings with potential friends, and ironically, there are a ton of people in his town who want to hang out with him, but he doesn't have an interest in that. One of his coworkers is interested in dating him, but he seems completely disinterested in dating or dating her. He doesn't have a whole lot of hobbies. He doesn't have any friends until the end of the movie when he starts to make an effort. He has flat affect and coldness and detachment. So like I mentioned, in this movie, he kind of uses the doll as a transitional object, which is not super important for the purposes of this video, but essentially it's like a form of therapy for him because he's learning how to connect to other people by kind of practicing on a doll. Now moving on to schizotypal personality disorder. And this one is defined as a pervasive pattern of social and interpersonal deficits marked by acute discomfort with and reduced capacity for close relationships, as well as by cognitive or perceptual distortions and eccentricities of behavior. So this one is a little bit more complex. It's not just about the social aspect now. We're getting into something a little bit closer to schizophrenia. So you need 5 of the following symptoms. Ideas of reference, excluding delusions of reference. So this could be something like an intense preoccupation with astrology, thinking like this completely tells me what is going to happen this week, for example. Thinking that something on TV is a sign could be another example of this. So an idea of reference is essentially you think that the environment is giving you messages specifically to you. Odd beliefs or magical thinking that influences behavior and is inconsistent with subcultural norms. So this is something that goes like beyond religion, for example. This is something like someone thinking that they can read minds or, move objects with their mind. Someone who is over the top superstitious, someone who believes they're a witch or a sorcerer, someone who believes they have powers, things like that. Unusual perceptual experiences. So this could be something like thinking someone is saying your name, or thinking that you saw the same person following you tonight as you did 2 years ago. And I wouldn't say they're like full-blown hallucinations and delusions, but they can be. Odd thinking and speech. So they might be overly vague. They might not be making a whole lot of sense. They could have like a word salad where you're having a really hard time following their train of thought. They may be over elaborating on things. Suspiciousness or paranoia. So these could be conspiracy theorists, anti-vaccinators, anarchists, doomsday preppers, just generally very paranoid types of people that think others are always out to get them. And I'm not saying all these categories of people aren't inherently schizotypal, not at all. It's just that they have this tendency towards paranoia where they might find themselves in these classes of people. Inappropriate or constricted affect, so they're not expressing emotion in a culturally appropriate way, similarly to schizoid individuals. Or they might even show emotion in a completely over-the-top way, like going up to a tree in the middle of downtown and hugging it, for example. Behavior or appearance that is odd, eccentric, or peculiar. So they might just generally say and do things that don't make sense to other people, that kind of make people think you're weird. They might be wearing really over-the-top clothes, like maybe they only wear pirate clothes. I realized the irony of me wearing a pirate shirt today. Promise that's not what's going on. Lack of close friends or confidants other than first-degree relatives. So this is the same as for schizoid personality disorder, but for schizotypal, it's usually more the result of them kind of weirding people out, so to speak, rather than actively pushing people away. Excessive social anxiety that doesn't diminish with familiarity and tends to be associated with paranoia rather than negative judgments about the self. So we know that people with social anxiety disorder are intensely anxious about social interactions because they don't want to be judged, they don't want to be negatively evaluated. Whereas here, it's not usually because of this, it's usually because of the paranoid thoughts that they think other people are going to hurt them. And so a little more information about this disorder. They may be more prone to brief psychotic episodes when they're under extreme stress. 30 to 50% of individuals are also diagnosed with depression concurrently. And we know that genetics definitely plays a role because they also tend to have family members with schizotypal personality disorder, as well as family members with schizophrenia. So this is definitely more on the schizotypy spectrum. It might not be at the level of schizophrenia. It might not be that they have reality testing completely compromised, but it's definitely on the continuum. So an example of a schizotypal character, I was thinking Kramer from Seinfeld, but I realized I didn't really have enough information to diagnose him with this. I saw that people online were saying Luna Lovegood from Harry Potter is definitely schizotypal. From what I can remember of her, that seems accurate. I don't remember a whole lot about her, but apparently she has ideas of reference, odd beliefs, or magical thinking. And like in the context of a witch school, this is not considered odd, but I think people would argue that she's odd even for someone in a witch school and that her beliefs are kind of eccentric even within that context. Unusual perceptual experiences, probably. Odd speech, constricted or flat affect. Odd behavior, such as, the only thing I can remember about Luna Lovegood is when we're introduced to her, she's reading a book upside down, so that's definitely strange behavior. Lack of close friends, and genetic predisposition. So I heard there was something with her father that suggested she might have this, but I'm not sure what the details are. Just to kind of summarize, schizoid I think of as kind of the negative symptoms of schizophrenia, and schizotypal personality disorder is getting closer to schizophrenia on the schizotypy spectrum. I hope this was useful and cleared up any confusion. Don't forget to hit like and subscribe if you want to see more of my content, and I'll see you tomorrow.